So how long should you wait until you consider having a second hair transplant surgery? Typically speaking, some clients will require more than one hair transplant surgery because this is a work in progress. As we age, we're all going to lose hair, our cells will age, and therefore, even if you don't have an underlying condition, you will thin in terms of your hair density. We all will require top-ups at some point. After a hair restoration surgery, we normally advise patients to wait at least 6 months to see approximately 50% of the final results, and then a year for 70% of the final results, and 18 months to 2 years to really see the full sense of the result. Now, the reason why there is these time lags is when we take the hair from the back of the scalp, it's typically in one of three phases. It's either resting, growing, or dying, and then the cycle replenishes. So we don't really know which cycle the hair is coming from the back to the front. So we have to wait for all these cycles to catch up. And of course, once a new cycle starts to enter the growth phase, the cycle which was in the growth phase may now enter the resting phase, and so on. So typically speaking, with patients, we normally have a rough idea of how they're going to look around the 6 months to the year mark, looking at the trajectory of how hair growth is progressing. Of course, some patients during the consultation, which is a pivotal moment in your hair restoration surgery, the patient will be informed that they will require more than one surgery. Many of the times, these patients have goalposts in their life, weddings, large job securements, or big events that they want to aim towards in improving their aesthetic outlook and appearance. So at the 6 months to year mark, I normally advise them to consider their second surgery. And of course, some patients will do one. We'll tentatively advise them that they may need some more procedures. At the year mark, sometimes they're fine. They don't need a second procedure. They've been quite happy with their results. And of course, sometimes they require more surgery. So really it's a work in progress, but typically speaking around the 6 months to the year mark. If you want to be very conservative, you could wait for the full 2 year mark. However, if you are somebody who has extensive hair loss and your surgeon has informed you that you require more than one procedure, it's typically advised that you should obtain your second procedure around the 6 month to 1 year mark to help expedite the journey. Thanks very much.